Subscribe to our YouTube channel and press the bell icon to get the latest updates.
Hello and welcome to ThePrint. We have with us today the German ambassador to India, Mr. Walter J. Lindner. Welcome to ThePrint, Ambassador. If I can start quickly. Firstly, I would like to know what is Germany doing in terms of controlling the pandemic. We do understand that the number of cases are high in Germany, but the mortality rate has been severely under control compared to your other European countries like Italy, Spain, and France. So if you can shed some light on that.
Yeah, it's true. It's at the moment, as we speak, there are around 132,000 cases of positive tested Germans and around 3,000 deaths. This is comparison low, but I'm not a big fan of comparing too much and say, oh, these are doing very well, and why are these so good? Every country is a bit different. Every country has a different circumstances, and I have been Chancellor Merkel's commissioner for Ebola for a year when the pandemic was there, and also the experience was different countries have different circumstances, so you can't really compare and say these are better and these are not better. Of course, we have a really a solid health system. This helps, of course, and then we have very good scientific institutions which help also, and maybe a population which is sort of disciplined and listen to the government when they say please don't step out of the house. This might be a factor, but Italy has also these same factors. They're also very good. They have good scientists, whatever. There are so many factors which more the scientists could lay down, which could influence that. In short words, we are happy that we are in a positive trend, but we have to be careful. And as we speak today, the Chancellor is announcing measures how to continue in the next 2-3 weeks. I think it's important that we do this on a day-to-day basis and see trial and error. If some things work well, then we continue. If they seem to be the wrong direction, then we have to stop it again and move back. So that's why it's the same balance which you in India strike. We do the same between protecting the population, but also trying to give some incentives for the economy.
Also, if I can ask you, now that you have given a clearer picture, in terms of collaboration between India and Germany, firstly, what do you think India can sort of learn from Germany in terms of controlling the mortality rate, and in terms of other kind of collaboration to control the pandemic? What do you think should be done between these two countries in a bilateral format, let's say?
Well, bilaterally, the Chancellor has already talked to the Prime Minister last week on the issue, and then our foreign ministers, also Jaishankar and Maas, have also talked, and so there are bilateral, close bilateral talks and exchange of the situation. Now, as I said, it's difficult to compare India and Germany because the health system is different. You have 1.4 billion people. You have migration workers. You have many people who have in normal life difficulties in gaining their daily life. So this is, of course, a different ball game than you have in Europe. But of course, in this pandemic, we are all in the same boat. We learn from each other. We can learn from you, and you learn from us. We have already, that's what the Chancellor also was offering, and the Prime Minister offering, a better exchange of our scientific research centers. We have excellent research centers. You have as well in Bangalore and in Pune and in other places, so that we do more exchange on the scientific level and see whether we can do some common research on the same matter. So there is a lot of things to do. What we do here is trying to see how we help Indian health system to put some money on the table to help get the hospitals better equipped. We are just working on this as we speak. And on the NGO level, we try to also help other Indian NGOs which are doing some help for those people who are in need, who need to be fed every day. And so what we can do there, we do, and there's quite a lot which is coming up, I guess.
Okay. Also, Ambassador, you are aware of the fact that India has now started exporting some of the critical drugs which are otherwise in a restricted manner, being exported case-to-case basis, like the hydroxychloroquine and paracetamol. Has Germany also sought consignments of those medicines? If so, have you received them? When do you plan to get that? And what is your view, Germany's view, on those critical drugs?
Yeah, India is a producer, biggest producer in the world of HCQ and paracetamol, and so we do this. We have already ordered, German companies have ordered from Indian companies some quantities, and we were talking, and also the Prime Minister are talking with our Chancellor, that we are, and the answer is positive. We're getting these pre-ordered materials, and we are very grateful for that. And then now we are waiting for the material to arrive. And I think every paperwork has been done, and the Foreign Minister was very helpful, and so was the Prime Minister's office. So that's why I think in that we are in a good direction, and I think it's international cooperation in the fight against the virus is essential. Those countries who produce some materials, they show themselves in solidarity with others, and vice versa. So I think in this way, we really have a revival of international cooperation, I think, and we have to rethink in future how to even intensify our health cooperation.
Mm-hmm. Also, Ambassador, if I can ask you, in terms of the lockdown, we just saw Prime Minister Modi extending the lockdown till 3rd of May. Is that sort of impacting some of the German companies that are operating here? A huge number of them are present in India, especially the automobile industry, the car makers. Now that it is extended, will it add to their problems in terms of labor shortage and other things?
I mean, the lockdown is affecting everyone. It's affecting you, it's affecting us. The fact that we are sitting here in my residence we are all affected. And of course, the economy is affected too, and the car producers are affected, as are the vegetable producers, and as are the truck drivers, and as are the rickshaw pullers. Everyone is affected. So we are all in the same boat. That's why we have to, I guess, focus all our strength to make this period as short as possible. And in that, I think the good CEOs, they're already thinking to the future and see what do they do when on the day when it opens up again. So the car industry, as other industries, are totally global independent. The dependency is striking. You produce cars in, let's say, BMWs and Mercedes, if I mentioned too. The know-how comes from Germany, but they are produced in India, and the material is coming from maybe 10 other countries in the world. So everything is coming together, and then it's produced in India, and you export the car made in India. So it's a BMW made in India, but it has products of 20 different countries. Of course, in a globalized world, this all is clinging together. And now, if one chain of delivery is interrupted, it has influence and an effect to everything else on the let's say on the jobs of these people. So we try to ensure that we keep all these jobs. And you've even seen that some of the car producers are now setting up hospitals close by in Pune. I have read about that. So I think they do their share, what they can do to help us get through this. But the car industry worldwide is, of course, suffering also from the virus, as are the hotels, as are the travel agencies, as are the cruise ships. Everyone is affected. But good entrepreneurs, I guess, think now what to do on the day X when this all opens up again.
Mm-hmm. And I also understand, interestingly, I was reading some reports that the German car makers are now sort of focusing their production line in terms of producing ventilators. I do understand that will be mostly for the European markets and Germany and as such. But would you also, is there a potential to sell those to countries like India and others who are facing a shortage for ventilators and other medical equipment?
I must say I have read it also, but I don't know the details about it. I've seen that they are, innovative and bringing up these ideas, which is a very good idea. But I don't know the details. What's the plan? Where do they export it? How big is the production? We will come back to that when I get some more details.
And you also said that some of these carmakers are, trying to open up some hospitals, maybe in a small scale, to address these issues in whichever way they can, like it's been done in Pune. Is that the only example? Are there any other examples who are doing this kind of, community work, social work to sort of tide over the crisis?
Yeah, we are at the moment, we are very busy in our crisis management in the embassy with evacuating or repatriating our citizens. That's why I have other people in the embassy working on collecting the information, who is setting up, which German company is helping in which way, where are they setting up, like hospitals or community work or whatever. And then in a few days' time, I guess we have a better list of what is happening out there. I know from our chambers of commerce and industry that a lot is happening because these German entrepreneurs which are here, they're not here just for a month or a year or so. They are here to stay, and they love the country and they identify themselves with the country. So when something like this happens, of course, they feel like it's their own home. So that's why they want to see what they can contribute. And I'm pretty happy that the list might be pretty long.
Okay. Now that you've spoken about repatriation, sending some of your nationals back to your country, now how that exercise has been, considering that India is this huge country, there are several states and the borders were sealed. So you had to deal a lot with the local authorities and also with the Ministry of External Affairs, which I understand had extended a lot of help. Can you give us the experience that you just had?
Yeah, this was quite an operation. We had when the virus started to have impact in India, we had around 5,000 German tourists in the country.
Okay.
The specialty in this country is that most of our tourists are individual tourists, backpackers. They visit temples, they go to the Himalaya, they go to the beach, whatever. But they are not in big groups like in Morocco or in Turkey, where you collect 500 people in one hotel and then 500 in another hotel. Here, they were all individuals. So you had to first see how many are there and where are they in a huge, huge country, which is bigger than Europe. So this was the challenge for us to do. So we did internet, using the internet, of course. I did video messages every day for like 3 weeks, addressing to the Germans out there, if you're out there, please register with us. Let us know where you are and then register with us. Then once we had an idea where they are, we knew 5,000, and we recommended them to take the last flights, commercial flights out of the country. So maybe 1,000 left. So we have had 4,000 left on afterwards. And we were starting very early because our group was the biggest group of tourists within the European Union to fly them out. We had 12 evacuation flights from 7 different airports in the country. And we took out 3,200 people, not only Germans, but also people who, like Indians, who live in Germany, or some other European nations. So more than 500 people didn't have a German passport. So we took them out, and this was a major operation in a lockdown situation where you had the state borders were closed and many hotels closed down, restaurants closed down. So it was a difficult operation. It required quite some logistic, and so we have turned the whole embassy, which is quite a big embassy here, we had turned it into a crisis center with a lot of telephone lines, with really good logistic support. And of course, we had a very close cooperation with the Ministry of External Affairs. They were very helpful, Chief of Protocol and others. They were really helpful, and they tried their best. You had, of course, as actors, not only the Ministry of Foreign Affairs, but also the state authorities. In the different states of the country. Then, of course, health institutions, and then the police, and then so we have had a lot of things to consider. We had to also send out buses to bring people from Rishikesh, from Varanasi, from other places in these buses, and then drive them here to the airport. So all this was done within 10 days or so, and we were happy we could do it. Now we have like 300 more still in the country, 400 maybe, but very in different places of the country. And so we see what we can do. We might maybe not send another plane, but we try to bring them on buses and planes of other European countries where we find space. And what we're doing now is coordinating that. We coordinate every day through telephone lines, through contacts with the European Union, with these airlines, that who is sitting where, can we take them out and take them on that plane which leaves in 3 days from that place. So this is also a logistic entrepreneurship thing,
right,
which we do right away. So, but this is, I think we have done already quite a good part of that. But there's still, as long as there's still stranded tourists here, our job is not done.
Right, I do understand it must have been a humongous task. But so just to lastly understand, Ambassador, and this is a question that I'm shifting focus to the multilateral forum. We just saw that US has said it'll not fund any more to the WHO. Then there's this discussions going on at the UN Security Council on China's role in this entire pandemic. What is Germany trying to do in this scenario, being a member of the UNSC? Are you sort of pushing for the situation, for a discussion, if not passing a resolution? What is Germany's stand in that?
Yes. First, we do support the WHO. We support and we pay, and we think it's a good institution. If it has to be improved, like during the Ebola crisis, we found out some shortcomings. We tried to improve it, and we talked in the WHO in Geneva. The Chancellor went there. So I think it's always better to have a constructive discussion. If you want to change something, do it there. So that's what we did. We support the WHO, and in the Security Council, where we are non-permanent members right now. Yes, we are together with other nations there. We are trying to get a resolution done. We have already a discussion last Thursday, I guess, in the Security Council, where the Secretary General Guterres made an intervention and called for a worldwide truce, stopping of fighting everywhere in the world, and of considering health a threat to international security. That was the reluctance of many countries, saying, well, international health crisis is not a threat to international security. We think, since Ebola, and many other countries think, this is not true. As you can see right now, international health crisis like this pandemic can lead to destabilization, can of course lead to empowerment of countries, of course can endanger the lives of the peacekeeping troops, and can lead to a lot of issues which are then resulting in a threat of international security. That's why I think it's high time that the Security Council discusses more the ideas of the Secretary General, and we will see whether we can come up with a project of a resolution together with other countries. And definitely we will, once we will have our presidency in the Security Council in July, together with other countries, we might bring this as a major topic on the agenda.
Sure. Thank you so much, Ambassador. These are difficult times, so please take care, and thank you for talking to ThePrint.
Likewise, you stay well, please, and stay safe. Thank you.